there's another pelvic floor dysfunction that I think is lesser known, and we call this in the pelvic health world non-relaxing pelvic floor. And this feeds back to that idea of flexibility within the pelvic floor. And when we don't have flexibility within a pelvic floor, that can lead to symptoms in of itself. So women who have a non-relaxing, or sometimes called an overactive or a tight pelvic floor, might have some of the following symptoms. They might have coccyx pain. They might have difficulty fully emptying their bladder. So they might always feel like they're retaining some urine, or they might feel that they have some hesitancy. And what I mean by that is they sit on the toilet and they have to wait for their bladder or their pelvic floor to relax so they can empty their bladder. They might have painful sex. They might have constipation. You might feel that there's a lot of tightness around your glutes, around your hamstrings, around your pelvic floor itself. And so we need to look out for the signs of non-relaxing pelvic floor. The reason that this can occur is many factors. One of the things I see a lot clinically is people who come from a gymnastics, dance based background, because they are often told to fully contract their pelvic floor, grip their pelvic floor, and this can become dysfunctional over time. There's a spectrum when it comes to non-relaxing pelvic floor. So people might, have a non-relaxing pelvic floor in that they might have some coccyx pain, they might have difficulty fully voiding, but they might be able to have penetrative sex. Some people might be at another end of the spectrum, and we might be veering into symptoms of things like vaginismus, and this is an involuntary contraction of the pelvic floor muscles, which does not allow for any sort of penetration. So that can be a finger, a tampon, a penis, whatever. And so there's a spectrum really of non-relaxing pelvic floor. What it boils down to is working on relaxing or learning to relax your pelvic floor, which we're going to come on to next. When we are thinking about learning to relax our pelvic floor, how do we do that? The first thing that I like to start with women who have a non-relaxing pelvic floor, wherever they are on that spectrum, is breathing. So remember that when we breathe, there is movement of our pelvic floor, and there should be a synergistic movement. So what should happen is I should take a deep breath in and my pelvic floor should bulge down slightly. This is a very subtle movement. And when you are someone who is used to really tensing through your pelvic floor, it will be difficult for you to start to feel this movement. But this is going to be a fundamental part of where we start to manage these symptoms. So, what I want you to think about doing is taking a deep breath in and seeing if you can feel a very subtle bowing down of your pelvic floor. And then as you exhale, a little recoil of your pelvic floor back inside you. Now, learning to feel these subtle movements of your pelvic floor is a great place to start. We want to feel that light movement of our pelvic floor so that we can see that it can be flexible. Also, pelvic floor, when we're breathing, can be really helpful to think about what breathing can do for us. So breathing in of itself can reduce feelings of anxiety. And often we find that women who have a very non-relaxing pelvic floor may be of an anxious disposition. And breathing techniques can be a very well-established way to reduce those feelings, particularly if they're anxiety around things like sex. So if we think about those breathing techniques, they are twofold. We are looking for that reciprocal movement of our pelvic floor, but also we are looking for those breathing techniques to calm our nervous system down. When we are in a very anxious state, what happens is we go into fight or flight mode, and that increases tension in our muscles. When we take nice, big, deep breaths, we push ourselves into a rest and recharge, a parasympathetic, like a parachute coming down nervous system, and that helps to relax our muscle tissue. So deep breathing is twofold when it comes to relaxing a pelvic floor. Yes, we're getting that reciprocal movement, but also what we are doing is calming our nervous system down to increase the likelihood that we might be able to relax that pelvic floor.